Hello, I'm Dr. Azhar Alam, consultant gastrointestinal, advanced laparoscopic and laser surgeon. And today I'm going to discuss about a very common colorectal problem known as anal fistula or fistula in ano. So what is a fistula in ano? Basically, a fistula is a tract or a road or a passage between the anal canal and the skin surrounding it. So basically, it's a bypass channel. What causes fistula in ano? Mostly if there is a perianal abscess or pus containing cavity, that is one of the most common causes for fistula in ano. Then it can be caused by certain conditions like inflammatory bowel disease, radiation, any trauma, diseases known as Crohn's disease, tuberculosis, as well as cancer. So cancer may also present as a fistula in ano. So what are the symptoms of fistula in ano? Most commonly, there is an external opening. So beside your anal canal, beside the region where you pass stools, you might feel there is another small hole or opening. There can be pus discharge, there can be pain, there can be fluid discharge, it can swell and burst, give you relief. Again, there will be accumulation of pus, again it will swell and it causes discomfort. But remember, it is on one side of the anal canal. So a fistula normally presents on any one side of the anal canal. So how would you diagnose it? A diagnosis is mainly clinical. So you visit your doctor will give a clinical examination and you will find an external opening. But once you have done the clinical examination, mostly your doctor will advise you an MRI. Why do you need an MRI? You need an MRI to characterize the fistula as to how long it is, where does it open, whether it has secondary branches or not. So an MRI is a confirmatory method to confirm and establish your diagnosis of a fistula. Now next, a common question which my patients ask me after seeing the report is, what is a complex fistula? So fistula has a lot of classifications, but one classification which is relevant for both the patient and the doctor is whether it's a simple or a complex fistula. So what is a complex fistula? A complex fistula has a lot of criteria, like say as to how long the tract is, how many openings there are on the skin, whether there is secondary branching or not, how much of the sphincter does it involve, greater than 30% or less than 30%, whether there is an associated abscess or another communication, how high or where the internal opening is, and also whether it is caused by any of the diseases like Crohn's disease, radiation, etc. Now that we know what a complex fistula is, we know how to diagnose it. The next common question is management. So the management of fistula clearly is surgery. There are no medicines which can cure the disease completely. But what are the common surgical methods? In the early era and even till date, the most common method is open surgery. There are two methods known as a fistulotomy as well as fistulectomy, in which we basically either lay open the fistula tract or completely cut the fistula tract. But there are certain things which we need to know over here. There is something known as incontinence, fecal incontinence. So what is incontinence? Basically, incontinence means loss in control over the bowel. That means normally we are able to control the passage of stools when we want. If the muscle around the anal canal is cut, then it is known as incontinence. So in that case, we will not be able to stop stools being passed. So when the urge for stool will come, normally we can hold the stools, but a patient who is suffering from incontinence will not be able to hold his stool. So that means if he is sitting and he faces the urge, stool will pass. If he is walking and he feels the urge, stool will pass involuntary. One of the biggest risk factors or complications following open surgery is incontinence, which can range up to 40% of the people who undergo open surgery. Another common problem with open surgery is the risk of recurrence. That means the fistula reappearing. There have been reports ranging from 7% to 50% of recurrence after open surgery. So what is the alternative? Today, there is an extremely advanced procedure and technology in the form of laser technology, wherein we, with the help of a laser fiber, we are able to seal the tract without making any big cuts, without having any injury to the sphincter muscle. So the advantage of laser surgery is that one, it provides excellent results. The recurrence rates are much lesser compared to open surgery. And secondly, there is practically no chance of incontinence since we are not cutting anything. We are just using a laser fiber to seal the entire tract. But there is another question which a lot of patients ask. Can we get laser surgery done anywhere? My advice is laser surgery is a highly skilled surgery and you should choose a center or a specialist which has sufficient experience in performing laser surgery, because if laser surgery is not done appropriately, there is a risk of causing a lot of harm, injury, including burn injury to the anal canal as well as injury to the surrounding surgeons. But laser surgery in the hands of a good surgeon, a skilled surgeon and a specialized center will provide excellent results. Thank you.